Welcome back to a closer look. The Directorate of Social Change and Mental Health has been given the authority to resume management duty at the Laloki Psychiatric Hospital after a year of court battle with the National Department of Health on the legal authority to manage the hospital. The dispute of legal authority came about after the Mental Health Policy 2015 was implemented, stating that there should be a recognized legal body in charge of the country's only psychiatric hospital.
The Mental Health Services is part of the National Department of Health, a division that exists to date. However, there was a reform under the Department of Health that called for an entity to be recognized by the law. That entity is the Directorate for Social Change and Mental Health Services. Following that, a Mental Act 2015 was passed on the 29th of July 2015 by the Parliament, where votes were 78-0. The Act commenced on the 9th of February 2016, giving exclusive authority to the Directorate to manage the Laloki Psychiatric Hospital.
It's an act that recognizes and gives power for the administration of the mental health and the policies, the establishment of the board of the Directorate for Social Change and Mental Health, the appointment of the Chief Executive Officer, the appointment of the Director, and
the Board of National Department of Health and the Health Secretary did not agree with this and filed for a court proceeding on the 3rd of July last year against the Board of Directorate of Social Change and Mental Health.
That the Directorate for Social Change and Mental Health Services and the Director does not have any power to control over the mental health services, including Laloki Psychiatric Hospital. So, because of the disagreement, there were people supporting of the view that is the health department under the Public Health Act 1973 should control the mental care centers and hospitals, and including Laloki Psychiatric.
The court, in its findings and relevant assessments, made these declarations, giving full authority of management of Laloki Psychiatric Hospital to the Directorate of Social Change and Mental Health.
With this particular court order, what has happened was 9 months ago, the health department had taken us, especially Secretary Liko, took us to court and restrained us from doing any work for past 9 months or so. And now, court in its wisdom have delivered that Mental Health Act 2015 we were declared as a winner. And number two, the restraint order has been taken out all this time, and the cost will be paid to us. So this is a victory not for mental health, for the people of Papua New Guinea.
This saw the reinstatement of the hospital's Chief Executive Officer, Dr. Losavati Asi, Chairman of the Board of Directorate, Archbishop Cardinal Sir John Ribat, and the Director for Social Change and Mental Health, Dr. Uma Ambi.
And I want to be ashamed, and I want to say sorry, Dr. Wilba Losavati,
The executive team of the Directorate presented the court order to the medical workers of Laloki Psychiatric Hospital this week and made awareness to the medical team to perform their duties diligently.
Patient care overall. Patient care in mental health is a very important area because it's very unique, not like any other health. And we also have the public health side and the curative health side. And when we treat patients, we need to have, right people looking after them, and it's a team of people who. So the Laloki Psychiatric Hospital is mainly looked after the forensic psychiatry and the long-term stay of major mental illnesses, and it's the one and only hospital for the whole country since 1957 or something like that, in those areas, even before I was born. So it's a very well established place to look after these things. So we deal with the legal issues and also the mind, the sound of mind, and also physical issues and so on.
This allows for the newly established Directorate of Social Change and Mental Health under Mental Health Act 2015 to manage the Laloki Psychiatric Hospital and other mental health centers in the country. Dr. Losavati Assis said their aim now is to maintain the status quo of the hospital. While addressing the health workers, the CEO also announced the reinstatement of acting appointees that were approved by the board.
I had a management team which we were operating very well, and we could see that we were going forward very smoothly. But unfortunately, this was somehow hijacked or changed. So that's why I have to get my team back, because these are people who are working well with me, and they have no objection or of destroying or it's. All of us is aiming to boost up the mental health services here in Laloki Hospital for the sake of the patients, people that we are serving.
The reinstated Directorate is well prepared to continue its work that was prevented by the restraining orders by the plaintiffs of court proceedings titled OS 177 of 2023.
When we left Laloki, we already had a restructured, already done. It was stopped implementing, we have done that. Number two, that we had a state-of-art development of this. We have done it all. It's ready to even kickstart things. We had, building for staff quarters and national planning, mobilized 10 million to us. That was restrained by the health department. So we couldn't do, if not by last year, we could have built the staff quarters. Then, as a directorate, we will improve the infrastructures throughout the country, and human capital will be improved. And
CEO Dr. Losavati Assis said one of the main objectives of the hospital now is to redevelop its facilities, as there has been no development to it since its establishments.
This place, Laloki, was established like in 1967. From that time till now, there's really not much changes, not much redevelopment in the structure. We are just a 60-bed hospital capacity, looking after the whole country. So you can see how overcrowded the patients are going to be in those wards. So it's been built in the colonial days. So one of our vision and objective is to redevelop this hospital, make it big.
The CEO acknowledged the court for recognizing the importance of mental health services in the country and encouraged its staff to put their differences aside for the good of the Laloki Psychiatric Hospital.
We will now take a quick break, and when we return, we will delve into the subject of the Infant and Young Children's Food Supply Act 2023.